One bill that is making its way through Albany right now is the Modernization Act. It's a bill that would let nurse practitioners open up their own shops without the collaboration of a licensed physician. Supporters of this measure say it will drive down healthcare costs, and they point to the 18 states where this is already happening as an example. Joining me now to make the case, we have Dr. Stephen Ferrara. He is the Executive Director of the Nurse Practitioner Association of New York State, and Nurse Practitioner Joy Elwell. Welcome. Welcome, both of you.
Thank you.
Okay, so this bill has been floating around in Albany for a while, right? How long has it been there?
It's been there for about 6 years.
Okay. And I understand that it's actually moving at this point.
It is moving. After sitting down with some of the stakeholders and going back to the legislatures, we've been able to work with them and get a bill that we're all comfortable with. And that's why it's moving at this point.
Were there significant changes that were made?
There were changes to the language. So what nurse practitioners will continue to do is collaborate with physicians. There just won't be the written requirement of this collaboration anymore, which right now, without this collaborative agreement between a nurse practitioner and a physician, nurse practitioners cannot practice at all.
Right.
So it eliminates that written paperwork. And that's really one of the key changes. What will continue is the relationship between a nurse practitioner and a physician.
So that means that you can't just sort of go out on your own as a nurse practitioner.
Well, nurse practitioners don't want to necessarily go out on their own. They want to be able to work as part of this healthcare team, but they also want to work to our full training and scope of practice, not being limited by what this piece of paper can tell us what to do.
So the paper, Joy, how onerous is it exactly?
Well, I can tell you that it can be onerous. For example, you mentioned nurse practitioners want to go out and open their own shop. Well, I happen to own my own shop.
You do?
I do.
Okay.
And if my collaborating physician quits on me or moves away or passes away or for any reason his license or her license terminates or our agreement terminates, I have to close my doors. My patients lose their primary care provider, and that's a problem.
Yeah, particularly because there's a doctor shortage, and because, and I mean, just reading the background, but we knew this also just from various different stories, because Obamacare is kicking in, you're having an influx of new patients into the system. So not only would you have to close your doors and your current patients, I don't know if you're accepting new patients, but you wouldn't be able to accept anybody new either.
I would not be able to accept anybody new. I wouldn't be able to take care of the patients I take care of right now. The literature says that New York is already short 12,000 primary care physicians. So when January 1st, 2014 comes, which is when the full implications of the Affordable Care Act will come into being, we will have millions more Americans eligible for health insurance, and we need every hand on deck.
So when you say that you're collaborating, you're talking about there will continue to be a collaboration. That doesn't mean necessarily both people in the same place. Is that the doctor and the nurse have to be in the same place?
No.
They
don't. Even as it exists today, the nurse practitioner and the physician can be off-site. So nurse practitioners have some level of autonomy right now. It's just tied to this agreement. So nurse practitioners do have their own practices. They're seeing their patients. They're providing high-quality care, just, again, without that written requirement. As it stands right now, the nurse practitioners are working as part of the solution. Nurse practitioners want to be more part of that solution as those estimated 1.3 million new patients in New York come online.
And what is the, there's about 16,000 practicing in New York State right now, nurse practitioners. What's your expectation of how many more people would be able to be practicing more autonomously? And particularly, I know in some of the rural areas in New York, it's a huge problem. Either one of you guys who can answer that question.
Yeah. Well, there's 52 of the 62 counties in New York State are designated health provider shortage areas. So we're certain that nurse practitioners will fill in some of that gap. If they don't have that physician as it currently stands, they can't practice at all. So the idea is get rid of this requirement on paper, and the nurse practitioners can take care of those patients.
And how would it change things for you personally?
Yes, it would change things for me. One of the requirements right now is that there is a retrospective chart review. That would go away.
What does that mean? I'm sorry.
That
what does
means that
mean?
every 3 months or quarterly, the collaborating physician and the nurse practitioner have to sit down and review a mutually agreed upon number of charts, which doesn't sound onerous. However, in reality, how meaningful is that review? The patients are already gone. It is retrospective, so it's not anything prospective or helping to plan care or improve care. The real improvement, if you will, for the working condition for the nurse practitioner is people like me, who own their business, don't have to worry about their business being closed because a person in another profession leaves.
Is that something you actively worry about a lot?
I worry about it every day because since I own my practice, all the checks have my name on them. So I pay the bills, I pay the rent, I pay the taxes, I pay the insurance, I pay everything. So to have to worry that a collaborating physician might leave, might pass away, anything bad could happen to that agreement, I do worry about that. I will also say that just because this bill gets passed does not mean we're not going to collaborate. We want to collaborate. Collaboration is the hallmark and cornerstone of nurse practitioner education. We don't need a piece of paper to tell us to do that.
Okay, so what does collaboration mean then, technically?
So technically, right now, as it exists...
Well, right now it means that you need the piece of paper, right?
Right.
But going forward, I mean, when we talk about collaboration, there's this chart review, but you're not speaking to your collaborating doctor every day.
No, I'm not.
You're not. Okay, so
No.
what does that mean then?
It's on an as-needed basis. So the nurse practitioner makes the determination whether this patient is within their scope of practice. If it falls outside of their scope, nurse practitioners are going to do what any provider does, which is pick up the phone and call their colleague, call an expert in the field, and say, I have this patient with this condition, and when full collaboration means both parties get something out of it. It's in the best interest of that patient.
And some people might not actually know, but what is the scope of what a nurse practitioner can do is actually fairly large, is it not?
Yes, it is.
It is. So it encompasses what exactly?
It's very broad. Nurse practitioners diagnose, treat, and prescribe for acute and chronic health problems across the lifespan in every population that is appropriate to their training and education.
So, right, okay. So your expectation is that when more people come into the system because of the Affordable Health Care Act, that actually they will be able to see someone as a result of this.
Nobody wants to have this lack of primary care and have these patients waiting 6 months to get into the system. That does nobody good.
So also, as part of this, there's in SED, which is actually the Education Department, which is handling the licensing, and the Department of Health are going to be studying the effects of the change. And why was that something that was requested by lawmakers?
That was.
Why?
That was for comfort, and basically the study is going to just look at how many nurse practitioners are in these collaborative relationships. Our bill has a provision for newly licensed nurse practitioners, so new grads, still require this written collaborative agreement for a period of 3 years. And what the department wants to do is just look at the stats and say there are this many nurse practitioners who are junior nurse practitioners practicing in collaboration with physicians, and that's really the extent of the study. So it's more of a report of the state of affairs rather than seeing if it's working or not.
And I guess before we close this whole conversation, I know that there's a doctor shortage, but at some point a couple of years ago, if I remember correctly, there was also a nursing shortage to the point that the U.S. was actually having people from other countries come in to be nurses. Is that still, are we still experiencing that? Are there enough nurse practitioners to fulfill the need?
There are pockets of nursing shortages. For new grad nurses, it's very difficult to get a job right now because the job market is competitive. Hospitals are consolidating, leaving less positions for nursing open. But nurse practitioners are sort of the next sort of logical way to go.
Well, we will be following this. I'm just curious, has it passed either house yet, this bill?
Last year
it passed the Assembly.
Right.
And it did not make it to the floor for the Senate for a vote. At this point, the bill is in both houses, so it's a two-house bill, and it is residing in the Higher Education Committee of each house.
Yeah, a little bit strange, but because of the SED licensing thing, I know it seems odd. Okay, so we'll follow it. Hopefully, if it passes, we'll have you guys back to talk about how it's going. Excellent. After a period of time. I thank you very much. Joy Elwell, thank you. Dr. Ferrara, thank you.
Thank you.